Nurses are extremely pissed off at the fact of being a nurse is not a profession. And they're right. Let's check this out.
As a nurse who worked during COVID, you're heroes. Thank you for all the hard work you did for taking care of our grandparents and keeping them alive and putting yourself at risk and not being able to see your family. And now we're not professionals. Now we don't matter? Oh, okay. Okay. Now you're not going to give out student loans to us anymore? Get ready for a huge dip in people who go into nursing. Get ready to not have people take care of your grandparents, because that's what's going to happen. And the people who do take care of your grandparents are going to be overworked and underpaid. So you go ahead and continue on with this if you want to. Eventually we're not going to have nurses because nurses are going to go back to school and do something else called not nursing, where we could get a loan for it. So remember, you did this, and since we're not professionals, many nurses are going to be signing out. Bye-bye.
Now, that is something that is all over social media right now with the fact of the nurses are extremely outraged. They're extremely outraged because the whole Trump administration came out with the whole student loan requirements or standards, I should say. Whereas now, as a professional, with like, for example, if you were like a doctor or like a lawyer, you would be able to take a whole lot more out during the times when you're going to get your master's degree, your MBA on the grad level. You were able to take an additional amount of money out, a huge amount compared to what now nurses are able to take out. Because from what I gathered, information that I was given, because my wife is a medical assistant, she works with nurses, and my wife right now is going to school to be a nurse. That to become a nurse is extremely expensive. So due to the fact of now they are not going to be able to have all that access to student loans, I don't know. To some people, it's a good thing, but to some people, to be given the opportunity to become a nurse if they don't have the funds and they understand exactly what they're getting into, to me, is all fair, right? They should be able to have that option. But damn, I think that's a straight up disrespect to say that is not a profession. After they were complete heroes, right? They were heroes. We all loved them back in the days. And Trump is going to receive a huge backlash for this. Why? Because women right now in that field is represented by 89% women. Okay, 89% of the women are represented in that field. Leave it alone. There was no need to touch it. We understand how important nurses are. If you're a nurse out there, thank you. We understand how important nurses are and the fact that they do a huge majority of the work. Whenever they go to a doctor's office, these are the people who take care of you the most, more than a doctor. Shoot, sometimes you never even see the doctor. You see the nurse practitioner. They deserve to be listed as a profession. But listen, right now there's so much outrage all over the internet, and this is not done. Check this one out.
So apparently nurse practitioner degrees are no longer going to be considered professional degrees under the new Department of Education proposed rules that go into effect next July. MDs and DOs, they are still considered professional. That makes complete and logical sense. However, NPs, not professional. CRNAs, not professional. PAs, not professional. But chiropractors, they are still considered professional under these new proposed rules. However, physical and occupational therapists do not fall under these professional degrees. They are not professional. Speech language pathologists, not professional. Theology and divinity degrees, yes, they are considered professional. However, teachers, the ones who are actually the ones teaching the entire country, are not considered professional. I truly cannot even put into words how much this does not make any sense. As someone who has been studying my ass off for 2.5 years in a doctorate of nursing practice program, completing clinical rotations and managing patients and sacrificing my time, my money, my sleep, and quite frankly, my sanity, to now be told that my profession is not professional is beyond disrespectful to not just NPs, but to every single professional healthcare degree out there. NPs, CRNAs, PAs, PTs, OTs, SLPs, social workers, even teachers. Like, it is so disrespectful in so many ways to not consider these professions professional enough to be worthy of loans. This decision doesn't just impact job titles, it impacts federal loan caps and affordability and access to education and the future workforce. It's all in all very insulting to every single advanced practice provider out there who works on the front line of a very broken system, but still chooses to show up for their patients every single day. So to the Department of Education, I don't know who came up with this list and how you guys decided on which profession is more professional than the others, but please go back and try again.
Yeah, they need to certainly revisit this because it just makes no sense because right now there is a lack of nurses. And everyone right now, man, feels like that everyone's getting sick. Hospitals are getting flooded. And around me, I'm always seeing an urgent care opening or a new hospital opening. So it's obvious that nurses are in high demand. Why are they touching this makes no sense. It really doesn't. And because the only thing I could think of, right, is the fact of there's this huge misconception that like doctors is like the only considered profession and nurses are just on the side, just handling whatever the doctor tells them. And that's not the case, right? That's not the case. And nurses, yes, because they're there emotionally, they're there to help you. That doesn't mean that they're not professionals. They are extremely professional. And the misconception is they're not doing surgeries or they're not doing anything like that. It's like, well, you know what? They're not considered professionals. That's a poor excuse because, hello, they do need to get a license as well. And for some reason in America, we have this perception when anytime someone needs to get a license for something, right, in their field, that is more than just becoming like an accountant, for example. You need to even get your license to get certified to do certain practices in the nursing field. So due to that, the difficulty of becoming a nurse is considered a profession. It's considered a profession. You guys drop a comment down below and you let me know. But the one caveat I would say is I don't love the idea of the fact of putting a cap. And I don't hate it either, but I will say this: we do have a problem with the student loan crisis. And whenever I hear like so much money these nurses are getting, and a lot of times it's not strictly just for the education. Some people use it for the lifestyle. That's really risky. If you ask me, I think you should just be able to just whenever you get the tuition, send it right in. It gets paid, and that's it. And the money that's left over, you cannot just go balling and do whatever the hell you want to do with it. Because some people take that money and they don't need it and they use it to just support a lifestyle that they never had to begin with. Drop a comment down below because I'd love to know what you guys think about it. But no, there's more. This is a whole lot more.
Hey, welcome in. What's up? Do some shit. Oh, hey. Keep your little fine ass right there. I'll be right back. So your blood pressure's high, but it's cool. It'll pass. We'll still give you the meds. No big deal. So we're going to do this laser on your face and put some botulism toxin at the same time. It might melt it off. It might not work. I don't know. It doesn't really matter. I'm not a professional.
Now that's funny, right? That's the way things are going to look now. That's what we're going to see now. People just being unprofessional. It's ridiculous, man. I love nurses. I really do. I always have a great experience with nurses. They're nice. They're down to earth. When you speak to a doctor, they have like... doctors can't explain things well. They speak in technical terms. Like, you don't know what the hell they're talking about. Nurses are the ones to always put you at ease and explain things a whole lot easier. They're professional. They laugh. They got joke. They crack jokes. I love nurses. I really do. Every time I take my child to a doctor, they're with a nurse. A nurse is always taking care of them and always making my kids feel at ease. And to be honest with you, sometimes I go places that say, what's the name of your primary physician? I think of my nurse first. That's the first person I think of because my primary physician usually is never around. They're never around. It's always a nurse that takes care of most of the situations. So that's funny, right? They're not professional. Like, what do you expect them to how to act, right? I mean, they're the best, man. They really are. For all your nurses out there, I'm sorry, man. This really, really, really sucks. And I think, in my opinion, is a lot of the nurses are not upset of the fact of, they're bothered by the fact of the cap, okay, for student loans. They're kind of bothered by it. It's just saying you're not professional. That's the part that is really irking them so much. It truly is.
The Department of Education recently made one of the dumbest decisions ever regarding healthcare. They decided that nurses, nurse practitioners, physician assistants, occupational therapists, and physical therapists, among others, are no longer considered professional degrees. Not only is this extremely insulting to some of the most integral healthcare providers that we have, but will also likely impact staffing of these types of practitioners. We're currently facing an extreme nursing shortage, and it's only going to get worse over the next several years. Now, there are a lot of reasons for this, but one big one is burnout. Surveys show that 4 in 5 nurses face extreme stress while at work. And this has only been made worse after the pandemic, where you get stupid people who don't respect them and will even assault nurses. And staffing shortages, partly caused by poor reimbursements from insurance companies to hospitals, cause these nurses to have to handle many more patients than they can safely handle. Now, on top of that, the Department of Education, headed by former WWE executive Linda McMahon, is now calling them no longer professionals. And this will limit the amount of federal student loans that nursing students can take out. Now, this can't make the nursing shortage worse, could it? Now, the fact is that nurses are the most important part of the hospital system. Yes, even more important than physicians. If all the nurses were to quit their job today, the hospital system and healthcare would fall apart literally within minutes. But if you think about it, if all the doctors would quit today, then nurses can actually keep this shit going for a while. And then you take physical therapists, all of them whom now are required to get a doctorate in physical therapy to practice. They too will be limited in the federal student loans that they can take, so that they literally will not be able to actually pay for schooling. I think Linda McMahon may have had too many DDTs and stone cold stunners that she has lost her freaking mind.
Yeah, the internet is outraged, man, and rightfully so. Rightfully so. I agree with it, man. There was really no need to touch it. There really was no need to touch it. And I mean, his analogy was perfect, right? It really was. If all doctors leave, nurses are able to run it. If the nurses leave, it will shut down. Well, guys, you hear what's going on. Drop a comment down below and you let me know how you feel. At the same time, hit the like, leave a comment, and subscribe.